Yeah, I can see that. Do you see also playing the role that somehow we still maybe consider that people who sleep long are kind of lazy, or this kind of social thing? I think it comes from the past times, but I think it's still alive.
Yeah, it's very much still alive. And even actually, even when you're a researcher like me, and I really pay a lot of attention on my sleep and I really value it a lot, even I have this subconscious feeling, oh, I slept in again and I shouldn't do this. And so, I can imagine that for many other people in society that must be even worse, or like this subconscious bad feeling must be even bigger. And so, I mean, there's a movement now going on that really tries to put more emphasis on the importance of sleep, because it's a mediator for many diseases and disorders, or the other way around. It's a very protective thing if you have beneficial and very, very healthy sleep. And so, I mean, we really have to value it more, I think, in society. And actually, in German language, at least, there's this really false friend, because we say that you're either a short sleeper or, also I have to say in German, I think for the people who speak German, so you can
Yeah,
be a Frühaufsteher or a Langschläfer, so someone who gets up early or someone who sleeps long. But actually, this pair is wrong, because you can be a very early type who goes to bed early and gets up early, but sleeps a lot.
yeah,
And you can be
uh,
the other one. You can be someone who's just very late, who goes to bed very late, gets up very late, but doesn't sleep long at all, just maybe 4 hours, 5 hours. And so I think language plays an important role here as well.
yeah. I can really see that. So, so you have done studies about this flexible school start time, looking the teenage sleep time and how it persists. Would you like to tell a little bit more about different studies that you have? You have done studies related to actimetry and sleep wake behavior of inward patients, and yeah,
Yeah, so usually I basically what I use in my studies as methods is usually actimetry, which is, you probably covered this here in the podcast, but it's just a way of measuring daily activity. And of course, you might wonder, how do I derive sleep from this? So basically, we have just the sleep or this rest activity patterns that we can use or derive from using actimetry devices. And then you have different algorithms you can choose, and then this would estimate your sleep time. And yeah, and so I use this for the school studies, but in addition, we also use this for other studies. Of course, it's a very, very common thing to do. And I also used it in a study in inward patient, so in a clinic where we studied people with depression as well. But there it already gets a bit more complicated, because as soon as you have medication, for example, that could affect your activity or your activity level, or also, for example, your sleep, if you have, medications that make you more sleepy because you have sleep problem and so on. So it gets very dirty there. And especially when people don't move a lot. So also, for example, in settings like care homes, where people just sit around the entire day and you don't have this marked difference between your daily activity during the day and your inactivity at night, then it gets quite difficult to estimate sleep. Yeah.
yeah. And how do you see? You said about medication. Do you know a lot of people using it that you would kind of see the effects of medication by measuring actimetry, measuring the physical activity and sleep parameters? Many, for example, antidepressants probably affect the activity behavior and sleep behavior. Do you know people using it kind of as an optimization tool for medication?
So I personally don't really. I only know it from the context in the clinic. But I do know that in the US, for example, it's much more accepted to take a lot of medication that would also affect your sleep or that sort of activity level, basically.
Yeah. And when you say actimetry, I assume you mean that you have an accelerometer on the wrist most of the time. These, oh, am I correct?
Yeah, exactly. I mean, in my case, I always use it at the wrist, and that would be that could be different manufacturers, of course, and you would wear it like a watch on the wrist, exactly. But in other populations, you could also use it on the leg, for example, if you study babies. So it's it's just that the algorithms that we typically use are mostly validated against or are used for when you have it on the wrist.
Yeah, I think there's like in physical activity, I think historically it's been on the wrist for certain reasons or on the waist, and now it's moving more to the thigh because we know more about sedentary behavior, and with the thigh we can detect. So I think there's a transition in the wearing location. How do you see in sleep and circadian research? Do you think the wrist is the best place, or do you think it's more like a historical reason that it's there?
Yeah, that's a good question. And I think, especially it might depend on the question and what you're really interested in. But if you already want to know more about body position, for example, I guess the wrist isn't really the ideal place to
Mm,
wear it. And I guess also if you think about that, it's quite a mess how we deal with this actimetry data. So there is no real common way where we all agreed, like as researchers, on how we pre-process this data and then determine this is like off wrist, which means that we are not wearing it, or just periods of unclear data where we're not really sure what the person really did, whether that was a potential nap or just, resting in front of your TV. This is always a problem. And so sometimes if you have more information, like, for example, temperature or also body position, it at least gives you additional ideas of what the person might have been doing. And so I guess we will need to see, but I think I'm not focused on we need to have it on the wrist. In fact, actually, the wrist can also be a bit of a problem if you, for example, like to sleep on your side or have your arm on your, underneath your head. Then this can be quite painful because when you sleep on it for like 8 hours, then you get these marks on your skin and it's really uncomfortable. And so this was actually one of the reasons why I wanted to try out the Fibion sensor, because I thought, first of all, I wanted to get rid of this off-wrist times when people take it off because they have a shower or they do some sort of sports, where, I don't know, combat sports or other things where you have to take it off.
mm,
And so you always have to clean the data, and this was relatively annoying. And the second thing is that it's can be very uncomfortable. So you already pre-select specific people who are comfortable with wearing these devices on the wrist. And for example, me myself, I don't really like it wearing watches or actimeters. And so I can definitely, I really know how it feels and it's not so comfortable. And so having tried out the Fibion sensor, this is not advertisement now, but I think it's just one of the good things that when you have it in such a way that you did it with the Fibion sensor, that it's just more, well, it's really not noticeable. So it doesn't interfere with the life of the with the daily life of the participants.
yeah, so maybe for listeners, the Fibion circadian, you wear it on the back, and it's quite a small sensor, so you shouldn't feel it. So basically, when you wear it on the wrist, it's kind of easier because people have used to wearing watches. They know how to put it on, but also it's visible. I haven't actually thought about that, but I usually keep my hand under my head when I'm sleeping on the
Hmm.
side, so that would be annoying. But then when you have it out of sight on the back or on the thigh, people don't take it off. How What kind of experiences you had? You tested with some people. How did they find wearing the device on the back?
Yeah, so basically we tested it. So we had participants who were wearing both the actimeters and also the Fibion devices. Although I didn't put them on the back, but on the thigh. So they were wearing it on the
Mhm.
thigh. And it's basically what I suspected. So basically, most of them were also fine with having them at the wrist, but they all preferred having it on the thigh. So also because they hardly noticed, they never had any problems that it was painful or anything. They also never took it off. And so basically I can reduce. I mean, one thing is that the patches, for example, if you wear it for a very long time, like I will maybe do that in one of my studies, that people have to wear it for very, very many weeks. Then, eventually your skin might get irritated because of the patches where you place it on. So that's a bit of an issue. Yeah, I mean, there might be things around that. Yeah. And so in general, I think it was like I expected, that it would reduce the non-wear time, and it's also more comfortable.
Yeah, yeah. When you said that if you wear it several weeks, I would then recommend changing between left and right. Maybe after 1.5 week, 2 weeks, I would change it probably on the other side. And how do you see basically from the thigh you could detect that are you sleeping on the left side? Are you sleeping on the stomach? Are you sleeping on the right side? Of course, it's a little bit your upper body can be kind of twisted a little bit differently than your legs, but at least it would give some indication if you are sleeping on the side or on the back. Do you see that useful information?
Yeah, I didn't hear that, so sorry. I don't know what you
Yeah,
said.
I go again. Yeah, technical glitch. So basically, from the thigh, you can detect whether a person is sleeping on the side or on the back. Do you find this kind of interesting or useful information, the sleeping positions?
So for my research question at the moment, it's not important to know that actually, but I could see that, I mean, it doesn't harm if you have that information. And eventually I could also maybe think about incorporating that into further research questions. So, I mean, if it's just another information that we have without really having to do any further effort, it's always good to have that, I think.
Mm, yeah. And and you said that people like to wear it more on the thigh than, or they prefer the thigh than wrist. Is there any disadvantages that you see from the kind of data point wearing it on the thigh? Is it less sensitive or something? Or how would you see compared to wrist? Is there
Mm.
difference detecting sleep and other parameters you want to measure?
Well, in terms of accuracy and so on, I don't know yet because I haven't really done the analysis. But one thing that I can think of is that usually actimetry or actimeters often also have a light sensor. And so you wouldn't really, of course, wouldn't really be able to measure light from the thigh, especially not when it, as long as you wear clothes on top of it. But having said that, at the same time, the light sensor that are integrated in the actimeters often are also really not useful because they're not at the eye level. And, as I explained earlier here, light is one of the important things for our circadian rhythm, also for alertness, for, making you less sleepy and so on, or more sleepy, depending on what light. And so although I get the light information from the actimeter, I mean, most of the time, especially in the winter, the sleeve would be covering it and so on. So the data are themselves sort of, we don't really know how good they are. It really depends. When it's in the summer, it's much better. In the winter, it's worse. And even then, sleeves are always a problem. So, I mean, in sleep research and chronobiology research now, there is this trend towards basically inventing new sensors that could be worn on the eye level, because this is where the information is important and not whether you have light on the wrist or not. But
Yeah,
so
so
for
we
the
yeah,
and
yeah,
so of
go on
course
first.
having it at the back or the thigh, you wouldn't really be able to integrate that with a light sensor.
Yeah, so we basically interested about the light hitting the eyes, but it's a little bit difficult to have sensors in the head, maybe, or not so convenient. You could have it on the neck, basically like a necklace, which probably relates quite closely what the light that is hitting your eyes. Do you have any innovations? What kind of things people have tested with the light sensor? How could you conveniently wear it?
Mm. I mean, the necklace idea is exactly the one that people have tried out. Then there's also another one where you could attach it, so you would wear glasses and then it would be sitting on the side of your glasses. So I would look a bit like, an alien.
Mm,
These were the sort of main things that were tested. We are currently developing one in the lab now as well. And so, I mean, the thing is, it's not a big market. This is where the innovations always stop, because then one lab or one group, invents one and then no one really buys it and it's only for researchers, and then, it dies. And so this is a bit of a problem, because we could have a lot of really nice data and important data that really would be valuable, but it doesn't, the field isn't big enough, I think. You would need to try to give us a good argument to to make Apple
mm,
this, but then even if Apple does it, then we don't have access to it. So that's the other problem.
yeah. Yeah, and if you have a light sensor that can distinguish different color of light, you can probably detect like if person is using screens. If you have it on the
Yeah.
eye level and you detect the blue light, is it correct or does it work like
Yeah,
that?
exactly. I mean, you wouldn't necessarily be able to say this person is definitely in front of a laptop, but you would be seeing that this person receives a lot of specific light. Although having said that, the sensors that are currently in use only give you basically light intensity and then a specific wavelengths, but it's not the unit that they use and the way it's measured. This is not the unit that is sensible for the eye, so this is not how the eye perceives it. And
Mm.
so new sensors also need to integrate different ways of measuring it. So it's actually a more meaningful value that we get out of these sensors that make sense that make biological sense, basically.